Warning: 5 signs of sepsis in seniors often ignored. Watch now before it's too late. Imagine an ordinary morning like any other. Your phone rings. It is your mother. Her voice sounds weak, confused, and trembling on the other end. She says she is burning up with fever, but strangely, she feels frozen to the bone. Her hands shaking so much she cannot hold a glass of water. What do you think at that moment? You tell her, "Mom, you probably just have the flu. Just lie down and rest. Take a fever reducer and I will call you back later." She hangs up. 3 hours pass. When you call back and no one answers, you rush to her house. Now, she is no longer resting. She is lying motionless on a gurney in the emergency room, surrounded by machines beeping incessantly and white coats rushing about. The doctors look at you with sad eyes and say a single word: sepsis. They add a sentence that will haunt you for the rest of your life. If you had brought her here just 2 hours earlier, her chances of survival would have been entirely different. This heartbreaking scenario is not a movie. It is a brutal reality happening every day, every hour at hospitals across America and around the world. Right now, as you are watching this video, there are thousands of people lying in bed, convincing themselves they only have a mild flu, while their internal organs are beginning to shut down one by one. According to data from the CDC, Centers for Disease Control and Prevention, sepsis kills at least 350,000 Americans every year. Do you know how large number is? It is more than the total deaths from breast cancer, prostate cancer, and the AIDS pandemic combined. Yet, if I were to ask a random person on the street about the signs of sepsis, they would shake their head. This lack of knowledge is the very gap through which death enters. Before we dive deep into the 5 golden warning signs that could save your life or the lives of your parents, I have an urgent request. This information is vital but is often restricted by social media algorithms because it is too blunt and too harsh. To protect yourself and the community, please press the subscribe button right now and turn on the notification bell. Your like is not just support for me, but a way for the algorithm to bring this video to elderly people lying at home alone, helping them recognize the signs before it is too late. Are you ready to arm yourself with the weapon to protect life? Let us begin. Many patients come into my clinic and ask, "David, I have an infected wound. So is that sepsis?" This is the first fatal misunderstanding. Sepsis is not a type of infection. Sepsis is the name we give to a frantic, extreme, and catastrophic immune response of the body to any infection. To give you an easy-to-understand example, imagine your immune system like a modern fire alarm system installed in your house. Normal case: a small fire occurs in the kitchen, an infected cut or a sore throat. The alarm rings, you use a fire extinguisher specifically on that fire. The fire is out, the house is safe. That is how the body normally fights. Sepsis case: your fire alarm system malfunctions in a horrific way. Instead of just alerting the kitchen, it detonates bombs in every room of the house at the same time. It floods the living room with water and short-circuits the entire building. In sepsis, the chemicals the immune system releases into the blood to fight bacteria turn around and attack your own healthy tissues and organs. It is like an army in a panic opening fire on its own citizens. What is the price of this betrayal? Leaking blood vessels. Your blood vessels begin to develop tiny cracks, causing fluid to leak out into the surrounding tissues like water seeping through a cracked wall. Dropping blood pressure. Because fluid is leaking, the pressure in the blood vessels is no longer enough to push blood far. Multi-organ failure. The brain does not receive oxygen, the heart beats irregularly, and the kidneys stop filtering toxins. If not stopped within the first few hours, it leads to septic shock where the mortality rate reaches 40%. Why should we be especially worried about the elderly? CDC data shows that people over 65 have a sepsis mortality rate many times higher than younger people. There are 3 core medical reasons. Immunosenescence. Imagine the white blood cells, the soldiers protecting the body, of a 20-year-old are strong young men, reacting lightning fast. But at age 70, these soldiers are old, weak, slow to react, and sometimes confused. They let a small urinary tract infection or a scratch on the foot erupt into a massive fire before they start to act. Depletion of biological reserves. A young person can withstand a slight drop in blood pressure or a high fever for a few days. But in an elderly person with underlying conditions like diabetes, heart disease, or COPD, their organs are already operating at their limit. A slight push from sepsis is enough to cause their kidneys or heart to collapse completely because they no longer have the capacity to compensate. The terrifying silence of symptoms infections in the elderly often do not show the same dramatic symptoms as in younger people. Sometimes they do not have a high fever, sometimes they just feel a bit tired. This silence makes families complacent, and that is when sepsis is quietly devastating the inside. We begin with warning sign number 5. Unusual changes in body temperature. This is the part that confuses many people. Normally, we think an infection must involve a high fever. True, most sepsis patients will have a fever over 101 degrees Fahrenheit 38.3 degrees Celsius. This fever usually comes very quickly and does not subside with common fever reducers like paracetamol or ibuprofen. But listen carefully to this. A significant portion of elderly people with sepsis do not have a fever at all. On the contrary, their temperature drops below 96.8 degrees Fahrenheit 36 degrees Celsius. This is called hypothermia. Why is that? Because their body is already too weak, lacking the energy to burn and create a fever to fight the bacteria anymore. If you see your loved one shivering uncontrollably, their skin cold, unable to get warm no matter how many blankets are piled on, but the thermometer shows a low temperature, do not be complacent. This is a sign of an extremely severe case of sepsis. The body is giving up against the bacterial attack. Warning sign number 4 is a change in heart rate and breathing rate. This is when the body is desperately trying to stay alive. Check your loved one's pulse. If they are sitting still, not moving at all, but their heart rate is faster than 90 beats per minute. You may feel the heart thumping in their neck or wrist. Why does the heart beat fast? Because blood vessels are leaking and dilating, blood pressure drops. The heart must beat incessantly to try to pump what little blood is left to the brain and vital organs. At the same time, observe their chest. Normal breathing is about 12 to 16 times per minute. If they are breathing faster than 20 times per minute, looking as if they just ran a long distance even though they are lying in bed, that is a red flag. The lungs are working too hard because the blood is no longer transporting oxygen effectively, or inflammatory fluid is beginning to flood the lungs. Many families see this and think, maybe she is just anxious or tired. No, that is the cry for help from a system on the verge of collapse. If you have ever seen a loved one with symptoms of a fast heart rate or unusual shortness of breath when ill, please comment, I have seen it, below. I want you all to share so we can better identify these silent killers. Warning sign number 3 is the sign that, throughout my 30 years in geriatric medicine, I have found most haunting and heartbreaking to witness. That is acute confusion in the elderly. Imagine your father or mother, people who were once sharp, remembered every anniversary, and joked with their grandchildren. Yet, in just a few short hours, they suddenly do not know where they are. They call out the name of someone who has passed away. They look at you with strangers' eyes, or they suddenly fall into a state of extreme sleepiness, unable to wake up despite being called. What is the fatal mistake that 90% of families and even some medical staff make? They click their tongues and tell each other, maybe the dementia is just getting worse, or maybe they are just tired and a bit confused. I want you to burn this into your heart. Dementia is a slow-moving snail. It takes months and years to destroy memory. But sepsis is a wild beast. It causes confusion in just a few hours. Why does the brain react this way? When sepsis occurs, inflammatory substances flood the blood like a toxic flood. They cross the blood-brain barrier and directly attack the neurons. At the same time, blood pressure drops, preventing oxygen from reaching the brain. At this point, the confusion is not a sign of old age. It is the scream for help from a dying brain. Never accept sudden confusion as normal. If they were normal yesterday and are confused today, it is a medical emergency. We move to warning sign number 2, a sign that is not found on a blood pressure monitor or a thermometer, but lies in the soul and instinct of a human. A sense of impending doom. In medicine, we consider this a real symptom, not mere psychological panic. Many sepsis patients, while still conscious, have grabbed my hand and whispered, "Doctor, I feel like I am dying." This is when the body has recognized the collapse of the major systems inside. When the kidneys start to stop filtering, when the heart starts to fail, the brain receives disaster signals sent from everywhere. Human survival instinct will emit an extreme warning signal. If your loved one says they feel something is terribly wrong inside their body, or they have an unprecedented fear of death, believe them. Do not try to reassure them with cliches like, "It's okay, you're just worried." Trust the patient's instinct because that is when their body is giving the final warning before falling into a coma. Warning sign number 1, the most visual sign, also the sign showing that death has stepped through the door, mottled skin. Take off the patient's shirt and look closely at the abdomen, thighs, or the tips of the fingers and toes. What do you see? Purple patches. Blotchy purple or blue-red spots that look like spider webs or bruises. When you press your finger on them, the color does not fade, it does not blanch. Cold and clammy skin. Even though the patient may have a fever, when you touch their limbs, they are ice cold and drenched in sweat. Why does the skin transform so horrifically? This is a negative defense mechanism of the body. When there is no longer enough blood to supply the entire system, the brain will order the tightening of all blood vessels in the skin and limbs to divert blood to save vital organs like the heart and brain. The skin is abandoned at this point. It lacks oxygen and begins to die. Those purple patches are evidence that the circulatory system is in total collapse. This is the thin line between life and death. If you see these marks, you are no longer counting in hours. You are counting in minutes. Now, let us talk about the worst nightmare in the ICU: septic shock. This is the stage where the patient's blood pressure drops below the level that can sustain life. Usually the top number is below 90. At this point, no matter how much fluid a doctor pumps into the veins, the body can no longer raise the blood pressure because the blood vessels have completely lost the ability to contract. Listen to this number to see the level of devastation. Once in septic shock, the mortality rate jumps to 40%. That means out of every 10 people, 4 will never return home. The kidneys stop working, no urine. The liver stops detoxifying, yellow skin, yellow eyes. The lungs fill with fluid. The patient suffocates while on dry land. Every hour that passes without the targeted use of antibiotics, the risk of death increases by 8%. Sepsis does not give you the chance to wait until morning. If you hesitate for one night, you may have lost your loved one forever. I am not here to scare you. I am here to give you weapons. When you suspect sepsis, immediately carry out this 3-step action plan. Absolutely do not wait. Do not wait for the loved one to be more alert. Do not wait for the fever to break. Call an ambulance or take them to the emergency room immediately. Sepsis is a forest fire. You cannot put it out with a cup of water at home. The life-saving keyword. Sepsis. As soon as you step into the hospital, among the dozens of patients waiting, grab the nearest nurse or doctor and say clearly, "I suspect my family member has sepsis." Why must you say this word? Because hospitals have a sepsis bundle protocol. This keyword will activate the priority system. Your loved one will be given antibiotics, fluids, and oxygen support within the first golden hour. Prevention from the root. Sepsis does not happen on its own. It begins with a small infection. Wash your hands. It sounds trivial, but this is the firewall preventing bacteria from entering the weakened body of the elderly. Vaccination. Flu and pneumonia are the 2 most common triggers leading to sepsis in people over 60. Get vaccinated regularly. Wound care. Do not disregard a small scratch from gardening or a popped pimple. Disinfect thoroughly and watch for signs of swelling or redness. My friends, we have traveled a long and intense journey together. I share these things not so you live in fear, but so you have clarity. Knowledge is a weapon, but action is the armor that protects the ones you love most. In my life, I have seen too much regret in the intensive care unit. I do not want you to have to say the words, "if only." If this video has helped you understand even a little bit about the dangers of sepsis, please help me perform these 3 spreading actions. Share immediately. Send this video to your family Zalo groups. Send it to your children, to your friends. Your one share could be a lifeline for a family out there. Interact to spread. Type "learned" in the comments if you commit to remembering these 5 signs. Type "shared" if you have sent it. I will read and cherish every one of your comments. Subscribe to protect. Press subscribe to not miss upcoming specials on heart and kidney health, our most vulnerable organs. Listen to your body, trust the instincts of your loved ones, and act lightning fast. Health is an asset, and understanding is the strongest layer of protection. Wishing you and your family peace and health. I am Dr. David. See you in the next journeys to protect life. Goodbye.